Could I ask a quick question?
Sure, why not?
Um, so I've I've been thinking about some of the approaches that were brought up, particularly in a sort of post 2020 BLM protests lens, and I'm wondering if the county is doing anything to kind of, one side of juvenile justice prevention is doing all of the preventative services and stuff that we're working on. Is there another initiative going on to address it in terms of like the actual justice system and advocating for youth?
So within the justice system, how are we making sure that the disparity is being addressed? Well, I think one of the things is we've been working on it for a long time through probation. So we started back in 2000 looking at we used to call it DMC, the disproportionate minority contact. In early 2000, we had juvenile hall that was very full. When I first came to the county, they were adding another wing on. We had a 30-bed facility, and juvenile crime was so off the charts, they were adding another wing. They started to look at it from a state level and saying something's going wrong here, and very similar to what we're seeing in the adult population, there are too many people being held at the state prison level for juveniles at that time, and it had a very bad rap for how it was treating juveniles. So the state started to put out block grant funding to the different counties. So we get two funding sources. One's the youthful offender block grant, and the other is the juvenile justice crime prevention grant. And so those dollars were really given to counties to start to look at things differently and say, we're not just here to lock kids up. We need to do services. Once we have a kid who's entered the system, we don't want to get them to the point where they're going to a state prison level system. And so that was really the start of doing restorative justice programs. We started our mental health program in probation and really starting to wrap around kids and do more parent support as well. It has continued to evolve. We brought in a company called Hayward Burns Institute. They're a national leader in looking at equity in the juvenile justice system. And we worked with them in the 2000s decades to really look at our kind of where we were doing things. And one of the things that we did is we implemented a risk assessment at the juvenile hall. And we started to meet with our stakeholders in the police departments and the sheriff's department and have that discussion about, well, why do we bring kids to the hall and what is the purpose of a juvenile hall? And started to show the science and evidence that putting somebody in jail actually typically worsens the problem. We think about it as punishment. When I was growing up, people used to say, oh, you should go spend a day in the hall and then you'll understand. The hall isn't a way to show people how to do better. And it's also in juvenile, not really a punishment. It's a way that we try to keep kids safe while we help them to get better. And so, we have since early 2010 not had juveniles come to our hall and do a stay because they're truant or for simple drug use. It usually is a sustained activity. We've had some horrific crimes, and of course the hall is there for that. But for the most part, the kids who are in our hall are either there pending a placement because they're no longer safe in their home or their community, or they are pending a trial or something serious. Proud to say, as of today, I think we have 5 kids in our hall. Part of that is due to COVID, but for the last 5 to 10 years, we've been having an ADP, which average daily population of 16 or less, and completely declining. Some of that is through legislative reform, like marijuana is no longer the same issue that it used to be, but a lot of that is working with our partners and saying, hey, the police agency, just because the kid's acting out doesn't mean they're going to go to the hall. We started diversion programs, working closely with the youth court and really trying to find different ways to divert kids from even getting a formal probation case, but just starting to give them services. We spend a lot of our block grant funds, the JJCPA, on people like Yango through Multicultural Center of Marin, so that as we're identifying kids earlier in the process, we start to set them up with positive role models, mentors, pro-social outings, and different ways to see the thing, to kind of see life and take advantage of things. We put a lot of money into prevention services now, and we watch the data, and we still see a disparity. Latinx youth by far and above are overrepresented within our system. And when we look at that, it's not because they're higher level of criminality. A lot of the time, it's because they don't have the same protective factors. And also there, you may have in our Latinx community, two parents who are always working and are not at home to watch over you. So you tend to be out in the street more, whereas the kids over in Tiburon are in their homes, even if their parents aren't home, they have a great home where they can go and do the same things, but they're not being seen. So a lot of this is helping people understand and change the modes. But then when they come to us, when a police officer picks up somebody, making sure that we do the right thing with that child. It's a very interesting conversation about equity because we do have, this disparity. And I get to see, I serve both juvenile and adult probation as the administrative director, and I get to see a lot of statistics and we see the disparity. We can talk about county, out of county, who's coming over, those types of things. But the most important thing is to look at each person as an individual and see how we can catch them at the earliest point and start to provide them the opportunities to change. That's something that we've been continuing to do. The county is taking a very, very proactive approach to equity in our probation department. We feel really good, like we've started on equity a long time ago because it's so important to us. We don't want to have kids in our system. We're working ourselves out of a job. So the county is paying attention. They are looking at this. Half of our probation juvenile funds are all going to prevention services. And the county is doing that as well and starting to look at it in a more coordinated effort. I know that Matthew Heimel, our county administrator, he meets with all of the criminal justice department heads. So you've got your district attorney, your public defender, the court executive officer comes, my boss, Chief Washington, come to those meetings. And actually Benita McLaren from Health and Human Services is also in those monthly meetings. And they really are starting on a new strategic plan to look at how do they work as a collaborative and really change these things. One of the things that we've definitely seen it change the criminal justice system through COVID is a realization that we have too many people in the adult situation who are stuck in jail when they're still waiting to even determine if they're guilty of a crime. So there's this pre-sentence population. And through COVID, many of those people who couldn't get out because of bail were able to get out to the monitoring of probation with a promise to appear as we start to provide services to them. Some of them may have to have a GPS or a tag bracelet just to ensure that they come back to the court. But it really has changed some of the perspectives in the sheriff's department, the district attorney, and the courts about who needs to actually be in jail. Because jail is not, it's an interesting concept. One of the things is you don't want people in there who are low-level offenders and are not guilty of crimes. They need to be out. They need to have their family connections. They need to maintain employment. When you put somebody in jail, even just for a weekend, it starts to break down all those things. And so we need to look at who's actually doing custody, who's doing custody before their sentence, and change those paradigms. We also are seeing, I forgot what I was going to say. But so there is a lot of work and there are a lot of good people who are looking at it. One of the things that the county administrator has recently done is pulled in a consultant. His name's Kevin O'Connell. He actually used to work for the court system. He's been a consultant to the chief probation officers across the state organization. And he's doing a study of our jail, kind of who's in our jail, what is the population, and how do we change this? I've been working with the public safety system for 20 years here in Marin, and for over 20 years, we've had inmate programs that other jails haven't had. So while things look bad in Marin, we're better than other places, which isn't a great thing to say. It's not just good enough to be better than others. We need to be best, and we need to be doing the right thing. But there is definitely a lot of work and a lot of very engaged people who are willing to have those discussions, those hard discussions about the district attorney. I have to be hard on crime. On the sheriff's department, I have to respond to the constituents that call me and tell me to come look at this person. And it comes down to continuing those conversations and also working with the community. And so juvenile it sounds weird. It's easier to bite off. For juvenile probation, we have about 143 kids. In adults, we have over 1,000 people that we're serving on any given day. So in the juvenile world, there's 50,000 kids in Marin. How can we start to demonstrate how a collective impact and really bringing people together from different disciplines and talking and actually voicing these concerns about disparity can make change. So that was a long speech that went into lots of different things.
Samantha, I just wanted to say I really appreciate your comments. Hi, everyone. I know there's very few of us left. My name is Leslie Manyweather, and I run the Family Connections program. Of course, I partner with probation, Marin County Juvenile Probation, and I'm really glad that you brought up the topic of equity. The probation officers know me well, and they know they hear me vent, and so yeah, it's a real issue, and I don't like to see kids end up in drug and alcohol program. I don't like them to see them in juvenile hall, but at the same time, it's just amazing how there's a lot of disparity. There's a lot of equity. There's a lot of there's work to be done. And I get kids across the board. I mean, our contract, we work primarily with drug, medical, and uninsured. So I will tell types of kids, but at the same time, I want to see them sooner. I want them to get preventive treatment sooner. I don't want them to come to our treatment program already severely addicted to the drugs that are out here in the streets now. And that is one of the things that, I know that's a conversation with the schools. I know that's a conversation with probation. I know that's a lengthy conversation, but that's one of the things that I am finding since I've been working with adolescents that really gets under my skin. I'm working with a client now who is in juvenile hall, as a matter of fact, and the brother, I'm not going to name names, the brother is addicted. How do I reach him?
Yeah.
How do I reach him? He's young, very, very young. So how do I reach him? I can't go to the school for privacy reasons and confidentiality and say, hey, I know your sister, and I know you're addicted to drugs and you need to come to my program. So, there needs to be a tighter, I don't know, I don't know the answer to that. I know that everyone is working. I just want to say thank you to everyone. Thank you to all the mentors, Multicultural Center, Probation, and all the organizations that are out there that are working so hard for our youth. My father, I just want to quickly say, Alex knew my father, didn't know him, but my father worked in McClymonds as a coach and scholar teacher. And, I'm walking in his footsteps very lightly, but I'm walking in his footsteps. So I really appreciate everyone's work. Thank you.
Yeah,
Thanks.
Thank you, Leslie. And I think,
if you have any referrals, can't wait to meet them.
We're going to try to get you out of a job too. No.
No. That's not
no, it would never happen.
As long as kids are ready to jump off a cliff into the water, with Risky and love doing experimenting, they're gonna come. Anyway,
and we'll never get rid of those children impulses. But I think a real focus for us is really how do we leverage Medi-Cal funding and local funding to push not just prevention, but early intervention and assessment into the schools.
I know what I'm going to be doing. I'm going to be, after pandemic. I mean, I had started pre-pandemic, but I'm going to be going and doing presentations at the school, presentations to organizations. So I'm a coming. Okay.
It sounds like you might be an upcoming lightning round for us.
Yeah. Well, maybe I'd love to.
Yeah.
It's always a privilege and always an honor to do this work. I've got to go. Thank you very much.
Yeah. And hey, Mar, please join our youth team, be a voice, and let's focus on this.
Okay. Will do. Take care.
Thank you, Leslie.
Thank you.